We became interested in this project because it's become clear that children with autism spectrum disorder have a high comorbidity with features of epilepsy. And conversely, children with epilepsy have a high comorbidity with symptoms of autism. And so the biological basis of this is really not known. And so we decided to conduct a preclinical study where we can start to evaluate this association between autism and epilepsy in a model of comorbid conditions. And so that's where we started. And we have previously shown that if we provide an intervention that can prevent inappropriate inflammation in this model, we can prevent the autism-like phenotype. And so we then became aware that the intervention we've used previously shares many biological mechanisms with compounds that are found in CBD, commercially available CBD products. And so what we're doing now is we're using a broad spectrum CBD product that's available commercially to see if we can replicate those initial findings when we use CBD as an intervention to prevent this inflammation. There's a second level of manipulation, which is the pups, the offspring. So in this case, the offspring are given a drug which acts on beta-2 adrenergic receptors, and the drug is called terbutaline. And terbutaline is a risk factor for developing autism in humans and pregnant mothers. We're conducting the studies in 3 different ways. One, the CBD is given to the mother. In a second study, the CBD is going to be given to the offspring. And then in the final study, it will be given to the mother and the offspring. We're in the middle of the first study, which is giving CBD to the mother during pregnancy. We have some initial behavioral analyses that have been completed that looks very promising, especially in terms of social behavior, which is part of our way of assessing the autism-like phenotype. Inflammation is caused by many different things, and that's what makes this field of study so challenging, because the inflammation could arise from a virus infection, it could arise from a bacterial infection. There's something that's often referred to as sterile inflammation, which is our preclinical research to clinical trials, which we've done successfully in depression and post-traumatic stress disorder. So best case scenario, we would proceed to studies in humans. Inflammation that occurs in response to stress exposure, psychosocial stress exposure. So we think all of these sources of inflammation can be important, and we can't really, in the human context, we can't really pin it on one causal agent. Essentially, we couldn't have done this study without the ICR funding. ICR funding has enabled us to initiate studies and carry out the studies, and we're looking forward to the next 2 years where we hope to complete the entire research program.